Now let's talk about the laboratory findings which we are going to see in the patients with COVID-19 infection. The lab presentations are very variable, and they don't give you a conclusive evidence of the disease manifestation, but they can give you a good idea, and they are basically being utilized as a screening test. So a lot of patients with the COVID-19 documented infection or suspected infection presented with leukopenia, which is basically a decrease in the white blood cell count. And contrary to this, in certain types of population, they have been found to have leukocytosis, which is an increase in the WBC count. So here you can see that there is basically contradiction. Certain population is having a low WBC count, and certain population is having a high WBC count. So this shows us that the disease targets, that the WBCs are basically the ones who are functioning very rapidly to overcome this disease, and their population can either go up and can get low. So any WBC abnormality in the background of classical signs and symptoms of fever, cough, dyspnea should raise suspicion of the COVID-19 infection. Another very important laboratory finding which has been very commonly found in patients with COVID-19 is the lymphopenia, or the decrease in the lymphocyte count. Lymphopenia is a very rare finding in other diseases, but it has been found in a majority of the patients with COVID-19. And if someone has classical signs and symptoms and has higher degree of suspicion, and we find lymphopenia on the laboratory findings, it is basically thought of that the patient has COVID-19 infection until we can get the confirmatory test via PCR or other investigations. And lymphopenia has also been found to be related to very severe manifestation of the disease. So the patients presenting with pneumonia symptoms, or the patients presenting with the ARDS, they have also been found to have lymphopenia consistently. So lymphopenia basically can also be used as a marker of the disease severity on the laboratory findings. Similarly, certain population have also been found to have increased lactate dehydrogenase, or LDH finding. Then serum ferritin levels have also been increased. This also shows that the patient might develop iron deficiency anemia, or iron stores are being used up to fight off the infection. Certain types of aminotransferases have been found to be increased. These are very non-specific. This generally signifies that the disease can also target the hepatic tissue, and that's why we have an increase in the aminotransferase. These are all basically the lab findings which are increased when we have a general inflammation or a general abnormality going on in the body. So there, as you can see, that there is no classical specific laboratory finding related to the disease, and that's why it makes it a difficult diagnosis, and you have to have a good higher degree of suspicion in the background of the clinical knowledge of the disease. Serum procalcitonin levels have been found to be increased, and this has been really a marker of a disease severity. Certain population which have had a very serious manifestation of critical disease, the levels of the serum procalcitonin have been found to be very elevated in these patients. So this can also be used as a screening marker, or to look at the disease progression, that if we have found someone with a very high serum procalcitonin level, and after 2 to 3 days their procalcitonin levels start going down, then we can think of it that the disease is getting better. Or in the contrary, if the procalcitonin levels start increasing, then we can basically have a good basically understanding that the disease is getting worse, and we need to act quickly to counteract the illness. Similarly, they have been found to be an increase in the D-dimer levels. This shows that the disease severity is getting increasing, and we might have certain types of coagulation abnormalities. So all these lab findings, lymphopenia being the most common, they are very common in other types of diseases as well. So that's why it is very important to have a thorough understanding of the disease with the clinical features and the overall disease basically severity in that certain part of the world to arrive at a diagnosis. And the lab findings can aid us, but they are not a definitive tool to diagnose the disease.